Hey guys, Dr. Eddy Dona, specialist plastic surgeon. I want to talk about a very important topic in plastic surgery, and that is BMIs and plastic surgery. What is BMIs? It stands for body mass index. And basically, it's a number assigned to patients based on, or people based on their weight and their height. And it's a crude indicator on a person's health or general health. General guidelines, anything below 30 is deemed relatively healthy, below 25 is great. Above 30 is considered obese, and above 40 is considered morbidly obese. So why is this important in plastic surgery? Well, a lot of plastic surgeons will use BMI or a BMI number to determine whether a patient is suitable to have surgery and whether they're going to offer surgery. A lot of surgeons will use a number of 30. Anything more than 30 is their cutoff. They won't offer surgery. Others will say 35. And of course, there are plenty like myself who don't consider BMI because I don't think it's that important. Let me explain. Now, BMIs and plastic surgery. Why is it deemed a concern? Because there are plenty of studies that have shown that patients with very high BMIs are at increased risk of surgical issues, such as increased anesthetic risk and increased in surgical risk, such as wound healing problems, wound issues, etc. Having said that, there are plenty of studies to suggest otherwise when it comes to certain plastic surgical procedures. In other words, there's no clinically significant increased risk. Now, the reality is, patients with a higher BMI, in other words, a larger body fat content, the fact of the matter is, when it comes to those surgical procedures, certainly like abdominoplasty, for example, for the surgeon, they are a very difficult operation. It's very demanding, physically very, very demanding surgery to do compared to someone who's got a BMI of 20 or 25. So technically for the surgeon, it's much harder to operate on a higher BMI. And the other important point is you can't do the same surgery that you do on someone like abdominoplasty, for argument's sake. If they've got a BMI of 20, you don't do the same technical maneuvers or steps in someone who's got a higher BMI, sort of above 35. You have to modify the operation to suit that patient. In other words, specifically tailor it so as to not create increased risk to that patient. Because at the end of the day, this is a very important point. Any operation in the wrong hands is a high risk operation. That's the most important point of this whole surgery. So you need someone who has the appropriate skills, experience in dealing with whatever group of patients we're talking about to ensure they get the best possible outcome and they are not placing them at increased risks. Now, my own particular survey or review of my own patients, I'm currently in the middle of doing that, 300 consecutive abdominoplasties or thereabouts, and the preliminary data shows that there's been no significantly increased risks to the patient or complications based on their BMI. So, like I said, when it comes to offering surgery, I assess a patient completely for the full medical history, physical issues. What are the issues they're presenting to me? What are the issues associated with their excess skin? That is primarily the issue when it comes to body contouring surgical procedures. What medical functional problems is that causing for them? Is their weight stable and sustainable? Take everything into account, discuss the pros and cons, because for every procedure you've got risk versus benefits. As long as the benefits far outweigh the risk and all this is discussed openly, then surgery is then deemed appropriate and we go ahead and I'm happy to offer the surgery. So these are the things we discuss in a full consultation. It's all openly discussed, pros, cons, and that's pretty much it. So no, I don't use BMI as an indicator on its own or in any way, shape or form as to whether the patient is suitable for surgery. The patient as a whole is considered. That's what I do. If you'd like to know more about plastic surgery and body contouring surgery, please feel free to give our office a call.